It's something that I looked for in the faith community that I wanted to join with my family. It's something that's very important to me and something that I'm very passionate about. And something that had been mentioned by the Reverend last week, and I completely agree with, is oftentimes social justice issues are not given their space in the church. And sometimes I feel like that's because of the feeling, like she was saying, you know, that sometimes social justice in politics feels like something that shouldn't always be spoken about. It can be controversial. It can bring up a lot of feelings. And that ends up leaving those that feel like they're dealing with marginalization or victimization or oppression, that there's no place for them at the table. And so I do want to make sure that I bring that up, and I'm very clear with how appreciative I am that this church continues, not only from the pastoral leadership, but also from the community, continues to give these type of issues a proper place at the table. I think that's very, very important. And it's, for me, it's also a fundamental way of how we really live our faith. So how we understand social justice as the extension and the action behind that call to love and care for each other, to be good stewards of earth, good stewards of each other. That's all part of the social justice piece, ensuring that everyone has what they need to thrive. So my background, just to give you a little bit of insight, is I was adopted, born in Bogota, Colombia. My brother and I were both adopted at a young age. My parents are Caucasian, and I had the opportunity and the blessing to be raised in a loving biracial home. And I feel like we really thrived because my parents were constantly exposing us to great diversity in a lot of different ways. We lived all over the country. We lived in California, we lived in DC, we lived in New York. And we often found ourselves living in communities that really sought to identify what was great amongst with diversity. The diversity really of thought, of experience, of perspective, of background, of culture really enriches everyone. And so I really do believe that I was blessed with that opportunity. And I feel like they really started me on a path, not just to embrace diversity, but also to understand the value of service. So I was raised in a home where service was an essential piece of my upbringing. I often joke that I never sat at the main table for family dinners because my mother always invited so many people. We were always in college towns, and she was always inviting international students to spend Thanksgiving and Christmas. And so even though we had a small nuclear family, the table was always open to whoever needed a spot, needed a dinner. And she really saw that as an opportunity to engage with other cultures. And so that's how I was raised. And that thrust me into my profession now, which is as a social worker. So that's my grounding, my training, my passion started in social work. I worked for over a decade at a community action agency that was committed to eradicating poverty. And part of that was within a Head Start, which was also part of Lyndon Johnson's War on Poverty, and really focused on offering comprehensive services to families so that children could thrive at an early age. And so with that background, that family background, that professional and education background, my family moved to Michigan. And so when I started to look for jobs, I was thinking about where I wanted to go next. And it just so happened that a position that I applied for was at the Ingham County Public Health Department. And the position that I initially came to Michigan for last August was as a medical social worker. And that was in Strong Start, Healthy Start, which is a home visiting program in Ingham County that works solely with African-American, Black, and Latinx families children and families, the focus being addressing health inequities in maternal and infant health. So the work there is very clearly driven by an anti-racist agenda to address the inequities that we see around us that have impacted some communities more than other communities. And then now, as Pastor Rick had mentioned, I'm now in the position of a policy analyst at Ingham County Health Department. And for me, it's kind of the merging of two worlds. I found that in a lot of ways, social work and public health have a real opportunity. Both have the community and the community health and well-being at the heart of their practice. And so I'm just really thrilled to be in a position at an agency and in a county right now that's focusing on these types of issues. So that's a little bit about who I am. I just wanted to give you some insight because while I am at the department, I really hope to kind of bring those different perspectives to bear on this conversation now, and then give you some insight as to some of the recent developments at the county level. And as an aside, feel free to stop me at any time, or if you would like to put something in the chat or you have a comment or question, I'm going to ask Pastor Blunt or Allie to kind of keep an eye on the chat in case anything comes up. I'm more than welcome to take any questions or comments while I'm speaking. So usually it helps me to have kind of a flow in mind for what I'm going to be talking about or what people should hope to get out of the discussion. So what I plan to do tonight is to take some time to look at some key terms. I know that you've been exploring issues about race, racism, and racial equity for a while now. A lot of you probably have been passionate about this topic for decades, but I think it's always helpful to review some terms quickly just to do some level setting, and so that we have a chance to make sure that we're using the same or similar terminology. Then I'm going to address some of what does it mean to say that racism is a public health crisis? And then we can discuss some of the recent resolutions that have come up in Ingham County and what that means in terms of Ingham County's approach to advancing racial equity. So key terms. So I'm sure that many are aware that there are often different types of racism defined, and the way that we often see it spoken about is these two different levels of racism. So there's individual level racism and there's systemic level racism. So individual level racism can play out in different ways, but predominantly the way we kind of categorize different types of individual level racism is we're talking about internalized racism, so that which lies within individuals' private beliefs about race and racism. So that might be my own thoughts, your own thoughts, how we internalize our feelings about that, how we value in our minds or kind of from our belief systems, people of different races. And then you have interpersonal racism, which is racism or how racism might play out between two or more people. So that type of interpersonal interaction of those feelings or those beliefs. And then on the other hand, we have something called systemic level racism. And that is speaking to these two other categories, institutional racism and structural racism. So the institutional racism we think about often when it comes to the unfair policies or discriminatory practices within institutions. And then structural racism would be a little larger, broader. It's the racial bias among institutions and across a society. So it's the broad impact, it's the cultural impact, it's how racism, some people will say, in a lot of ways we swim in racism, so those unspoken ways that racism has infiltrated different aspects of our community, our society, our ways of thinking. So what we're going to be talking about this evening is going to be a little bit more focused on the category of systemic racism. So that broader category that I just mentioned. And so examples that we might see of systemic racism within society, within our nation, within our neighborhoods, within our community are things like residential segregation. So the redlining, how different areas are broken up, how zip codes are broken up, discrimination in bank lending, discriminatory policing or sentencing practices. And then something that I think often is overlooked is the consequences of discrimination over lifetimes and generations. So a simple way of thinking about that might be the ways in which it impacts a family or a generation or a community of color if their grandparents did not have the ability to access employment or fair employment or fairly paid or compensated employment, or their great-grandparents, how that impacts the generational accumulation of wealth, the generational accumulation of power, and how that really sets us up to be at a different playing field. You know, and I think we'll be talking a little bit about in this slide, even the issue of equality versus equity. So oftentimes, I think for a long time, it was this idea of equality, equality, equality. That means everyone gets the same thing, and that makes things fair. That means that we are all set up with a fair starting line. And I think that we all know from basic experiences, whether it's something that's happened in our lives or something that we've seen happen with somebody else, that the starting line is different in a lot of situations for different people. And sometimes it's based on the way you look. Sometimes it's based on who you choose to love. Sometimes it's based on your class or your educational attainment. We see it obviously in terms of different starting places across different countries. So the reality is that there is not a common starting place that ensures people start at the same line. And so that's why a lot of the conversation has shifted from one of equality to one of equity. So the concept of equity is that everybody gets what they need to thrive. And so you'll see by this picture, everyone getting the same bike does not mean that everyone has what they need to ride. But once you start looking at the equity picture, you see that different modifications ensure that all those individuals have an opportunity to ride, you know, and everyone's bike might look different, but it ensures that there's an opportunity and there's a community commitment to that thriving that's very distinct. And sometimes it's me looking out for somebody else to make sure that they have the opportunity to thrive. And sometimes it's us looking out for other communities. And sometimes it's us standing up for what we see going on in our own community or our own family or our own network. And it doesn't have to be from a judgment piece, it's from a shift in seeing. So a lens or a perspective that's focused on how can I make sure that people have what they need? So then the other key term we often find ourselves talking about on the flip side of kind of the racism piece is moving past racism. What do we need to address these issues in a way that's fair and equitable? So we have these terms, health equity being the absence of unavoidable, unfair, or remediable differences among groups of people. So we're saying that if these groups of people who are different can still have the same opportunities to grow and thrive, regardless of how they're defined socially, economically, or demographically, you know, regardless of other means of stratifying or breaking up groups, that at the end of the day, health equity means that everyone has what they need to thrive. And then an equity lens.
Can I interrupt?
Yes, sorry.
And that is so biblical. If you look at what Jesus did, it was those people who were disadvantaged in his culture, he valued and said, no, the lepers deserve attention and women deserve attention. I mean, so for me, at the heart of the gospel is Jesus is all about equity, and people have what they need to thrive and survive. So,
right. Thank you. And then the other piece is that equity lens. And I think this is where we have real opportunities, you know. So the equity lens is considering the needs of and impact on historically marginalized individuals and communities, race, gender, class, in individual action or group planning process. So that's the idea even behind, you know, what are ways that we can implement what we believe, or how can we take action? I think that a lot of the action, the starting step for a lot of the action is, how can I make sure that I'm keeping equity at the forefront of my life, whether it be professionally, or when I'm on a planning committee, or when I'm looking at forms. Something came up the other day that really struck me. I was with my daughter at one of her physicals, and we were filling out some paperwork, and she looked down at the place where you mark gender, where right now on the forms that we were filling out, it said M and F for male and female. And she said, what about if you're non-binary? And it really blew my mind, in part because we talk about things related to social justice and in the home, but I'm not sure that I've had multiple conversations about gender, or, you know, the importance of really inclusion, or creating a spirit of inclusion. And my 13-year-old identified that immediately. And so I was floored. And so after we left, I said, tell me more about that. You know, I know we talk about some of these issues at home. Can you tell me why you noticed that? And so she said, well, it just made complete sense to me that they were leaving people out, you know. And as we kind of dug into that conversation, she reflected back on our move here. We moved from an area that was, at least on the surface, fairly homogeneous, you know, and we moved here in part to be closer to a university, to be in an area where we believe there would be greater opportunities for diversity of thought, diversity of experience, diversity of culture, diversity of language. And she said to me, especially here, in the sense we moved, she said, where we were from, although I knew that it was important that people be included, everyone seemed the same. She's like, and here I see people talking different languages, wearing different clothing based on culture traditions, having different outlooks on things, having diverse discussions, talking about their own preferences when it comes to who they love, you know. And she said, that just reminded me that there's so much difference in the world, you know, and that it's important that people feel included, feel welcome. And so for me, it just kind of blew my mind, because it kind of, that was the value that I saw in diversity, and that I hope that my children would see in diversity. And like I said, not just diversity of racial background, but diversity of thought, religion, political expression, gender identity, all these things. And you realize that there is a true intersectionality, you know, that being open and engaging and inclusive and thoughtful about one group naturally makes you flow into it more easily, potentially, you know, for everyone. And you kind of start to see that the more you identify these opportunities for inclusion, you see this richness, and you become a caretaker for others. It goes back to that whole caretaker piece, you know. So as you start to value the other, value the inclusion, value the diversity, you become an advocate, an ally, a caretaker, a friend, a confidant. You create a space that naturally can become bigger. And so, sorry, I didn't mean to take that journey down that path, but for me, that was something that was fairly remarkable and gave me a lot of hope too, because that's not something that I would have noticed at her age. You know, that wasn't in my frame of reference, that wasn't in the conversation in my home. And so for me, there were a lot of opportunities too in the moment that we're at. So then it kind of takes us to where we are now with racism as a public health crisis. And I thought that it was appropriate to kind of use this quote from Linda Vale. She's the Ingham County health officer. I actually had seen this quote in one of the articles that was related to Ingham County's resolution to proclaim that racism is a public health crisis. So it says, people of color are disproportionately affected by infant mortality, maternal mortality, diabetes, asthma, hypertension, and even COVID-19. This has nothing to do with biology. Health disparities are the effect of a lifetime spent enduring racism in all of its form, which compounds as it spans generations. And so it really is, in a lot of ways, you know, that reiteration of racism, not race, is the driver of health inequity. So I'm hoping that this will play. I'm going to see how it works. Let me see. Oh, there it is. So it's just a brief 4 minutes.
What determines how long we'll live?
Adriana, can you turn your volume up?
Oh, put my volume up. Okay, let me see. It might be as high as it can go, but I can always put it in the chat if that would be better.
I think go ahead and play it. And we'll all have to turn our volumes up as well, so.
Okay.
Thank you.
Yep. Yeah, if it ends up being an issue, I can always put it in the chat or at least have people have the opportunity to watch it another time. Oh, sorry. No, it sounded like people couldn't hear. Is that correct?
That's correct. Yeah.
Okay. So what I'll do is, let me see if I can pull it up real quick. Or I can put it in the chat for later and I can kind of give you a synopsis if that would be helpful.
I think that would work. Yeah.
Yeah. I think it's something with the sound has to be, I should have checked it before in the settings, but I will send it out. It's actually a great video. It's from the state of California, but it's that idea that even though people might live relatively close, the opportunities afforded to different individuals is very different. So if I live in Okemos and you live in South Lansing, you know, there's a different level of access to supermarkets, to healthy foods, to clean parks, to grassy places to take your child to play. Some communities, there's a huge disparity in terms of air quality. You know, that for a long time we've talked about environmental justice, and a lot of the environmental justice work is, I know a lot of you are very passionate and steeped in it, but it's stemmed in this idea that some communities don't have access to clean water. I mean, Flynn is a perfect example, but unfortunately, it's not the only one. And so you talk about air quality, you talk about congestion, you talk about all these different layers that impact people's ability to thrive. And it goes, so it really starts to make you think about health, not just from well, how do I live my life? What do I put in my body? Do I exercise? Do I not exercise? But you understand that there's this compounding pressure from things outside, to some extent, your control, that might have a huge impact on not just your life expectancy, but your quality of life. And so the focus of a lot of this video is just kind of giving the visual insight as to how those other issues impact life, you know, in the broadest sense of the word, life expectancy, and then also the everyday parts of your life, like what it's like to be a mom who doesn't feel like she lives in a safe area, or doesn't have a safe playground, or has all these other challenges, or what it's like to live in an area where there is a lot of pollution, and you worry about your child and why are all the children in this community, why does this community have higher rates of asthma in their children? And so you see how all these different things start to layer on, and that we have to move away from your health is based on your own personal decisions, and not just from a judgment point of view, but a responsibility point of view. Like how, once again, we come back to that caretaker piece. If we are to be caretakers for each other and our communities, it's to ensure that that opportunity is afforded to all. So I'll make sure that after we finish up, I send out this link. It's just 4 minutes, and it's a nice kind of visual illustration of what we see.
Adriana, I want to insert, when I first moved here 7 years ago, there was a single mother who really couldn't afford to live in Okemos, and her social worker kept saying to her, you need to move to Lansing. And she said, but if my kids graduate from Okemos, I know they'll get into college and they can break the cycle. And so our food pantry said, we think she's doing a wise thing. We will bend the rules and give her food more often, because it is the reality that schooling in Okemos is not the same as schooling in Lansing. And, you know, and it was like, how can we be that close? And a few miles makes a world of difference.
Right. Right. Yep. Perfect example. Okay. And so then I pulled this up. What's nice is the CDC actually allows you to do to look at life expectancy by census tract. So a lot of what we do is by zip code, but the reality is that the census tract data allows us to get dig a little bit deeper and get closer to neighborhoods and communities. And so the census tract allows you to really look at the different life expectancy within a smaller area than zip code. So I put in Okemos Community Church so that I could identify the census tract number that would line up with Okemos Community Church. And then I did the same thing for Ingham County Health Department. Ingham County Health Department is situated on Cedar Street in South Lansing, and that's where I work. And so you'll see here, the life expectancy for someone that lived in the area of Okemos Community Church was 81.7 years, whereas the location for the Ingham County Health Department, life expectancy was 74.3 years. So I jumped on Google Maps, and for an 8.4 mile distance, there was a 7.4 decrease in life expectancy. So it really allows you to see how this plays out. It's not just comparing our community to a community 10 states away. We're comparing the life expectancy rates for an area that's only 8 miles away. And you'll see that the average life expectancy decreases significantly. And so that's, I think, another way to kind of think about what we're talking about. You know, and to quote Martin Luther King, you know, there is an urgency of now. Like, this is happening now. Like, this reality is the reality that's playing out in communities across our country, across our world, you know, but there is something to be thinking about, ways that we can really engage in this work in a meaningful way. And I think that one thing that I will say is that even the partnership that you have with the school in South Lansing is a recognition and a realization of that. And I really see as a commitment to that, like a deepening of relationships, a deepening of partnerships, really working to develop new and innovative ways to have a positive impact. And I think that it's important to kind of call that out and those moments out, because that's where there's a lot of people say, well, I don't know what to do. And in a lot of ways, I think this faith community is actively looking for things to do and ways to engage in different ways. But that impact is felt, you know, you really, you help address the quality of life piece, you know, and you help to share insight and pull them into the discussion and help them be partners and have a voice at the table. And that's a really important partnership, I think, and a collaboration. So then a lot of what the video is kind of referring to is what we often refer to as social determinants of health. So social determinants of health are considered those conditions in which we are born, grow, live, work, and age. So it's all those kind of other factors that shape our life, you know, and our quality of life. And interestingly enough, they are also considered to be the most responsible for health inequities. So inequities when it comes to how we are born, how we grow, how we live, how we work, and how we age, then create additional health inequities, you know. And so those social determinants of health, they can be categorized in different ways, but typically or oftentimes you'll see them referred to within these categories, so they end up getting grouped. So this Office of Disease Prevention and Health Promotion slide just kind of shows, you know, they're seeing the 5 primary areas as neighborhood and built environment, health and healthcare, social and community context, education, and economic stability. And so that plays out in different ways. So I did these slides because I know that those kind of feel like big and entities, but when you break it down, economic stability is talking about what types of jobs are people able to get? What's the pay? What are the benefits? Do they get sick leave? Do they have vacation time? What happens if they call out sick? Have they lost their job? So that employment piece, food insecurity, housing instability, and poverty. And then when we talk about education, it's digging deeper into that early childhood education and development. So what are the opportunities for early childhood education? Is it quality early childhood education? They look at enrollment in higher education, high school graduation, and language and literacy. And then the other 3, the remaining 3, when they're talking about neighborhood and built environment, they're thinking about access to food, crime and violence, safety when you walk home, when you walk to work, when your kids go to school, environmental conditions, your quality of air, your pollutants, kind of what's situated in your neighborhood, what are the stores that are available, and quality of housing. Okay, so you have housing, but are you dealing with poor housing? Is there an infestation? Are there issues? Do you have what you need? Are there bed bugs? Do you have lead paint peeling off your walls and your toddler walking around? So those other pieces. Health and healthcare, access to primary care, and health literacy. So that whole piece of, do you have a primary care doctor? Is it someone that you trust? Is it someone that you can call? Do you feel like you know how to address some of those everyday health issues that come up? Is your emergency room your primary care doctor? You know, and what does that look like when you don't have someone that you can depend on, or when you don't know who to talk to? And then social and community connections. So it looks at things like civic participation, discrimination, incarceration, and social cohesion. And so those are all other important elements, and those are all kind of the pieces of the puzzle when you think about the social determinants of health, those other factors that are going to affect an individual and a community's health. So then we come to the intersection of racial equity and health. And so like I had mentioned a little bit a few slides ago, the APA came out with this. They said racism as a driving force of the social determinants of health and as a barrier to health equity. To achieve health equity, we must address injustices caused by racism. So this is kind of like the coming full loop. You know, we see how social determinants of health impact the health of individuals and communities. And now we look a little bit further back in the process and we see that racism ends up being a driving force of those social determinants of health. So you start to see how racism and all the other issues that we see in our community, so issues related to classism and homophobia and all these other aspects end up impacting social determinants of health, like education, where you live, where you work, where you play. And then we get to where we're at, where you think back to quality of life and life expectancy. I really liked this slide. I know it's busy, but I will kind of play it out or explain kind of why I liked it. It's actually from the Bay Area Regional Health Inequities Initiative. But I liked how they set this up, because what you see here in the middle, if you look under living conditions, this largest section in the middle, that's what we're talking about when we say social determinants of health. So that's the physical environment, that's the employment, that's income, that's healthcare. And then if you see how, if you kind of scroll to the left, you see how it's these social inequities around class and race and immigration and gender feed these institutional inequities that come up in systemic racism, come up in schools, come up in healthcare, come up in government, come up in policing. And then you see how those inequities, so that individual level racism and also systemic racism feeds into what goes on in terms of living conditions. It determines where you live. It determines all those other pieces, and how that ends up being a force that impacts health. So I know there's a lot on the screen, but I just kind of I felt like it provided like a larger framework for understanding the upstream, how racism ends up being an upstream influencer of social determinants of health, which then affect health behaviors, affect chronic health issues. And then here, this is one of the reasons too, I get really excited about being in public health, especially right now, is the new 2020 vision for the 10 essential public health services. This is the image of it. But what you'll see, what I'd like to draw your eyes to, is what's in the middle. It's equity. So the vision for equity being at the center of public health work and needing to be implemented, addressed, and used throughout all of these different areas is really what I find so heartening and so essential and so important. And let me just see if my slide will advance. Okay, so then moving forward, I know that I'm probably running out of time a little bit, but moving forward, I just wanted to provide a little bit of insight as to what's going on in Ingham County. So in Ingham County, what I pulled out was these 3 recent Ingham County resolutions that seem to have a real race equity focus. The first, I think, is what Pastor Rick was referring to initially when he mentioned the declaring of racism as a public health crisis. So we've seen this across the country, municipalities, cities, towns, states, but moving to really call it the way public health is starting to see it, or at least verbalizing what many have seen for decades, that racism is a public health crisis, that it's impacting the health and well-being of individuals and communities, and that there's no other way to say it. That race is not the indicator of health disparities. Racism is the cause of health disparities. And then the second resolution was the resolution to create the Ingham County Racial Equity Task Force. And I'll talk about that in a couple slides. And then a third resolution was the resolution to address and reduce implicit bias in all county decision-making by developing and integrating an equity process and health and all policies approach. And that's a public health approach too, in terms of seeing health as not, individual and community health not being a sector just for health departments, or not just a sector for doctors and medicine, that health really does require a multifaceted, integrated, strategic approach across nonprofits, faith communities, government agencies, that the doctors are not going to resolve our health problems because, like we've been hearing, health is not an indicator just of what I do with my own body, that health is impacted by all these other pieces, and therefore health needs to be addressed and integrated from a a collaborative approach that really calls us all once again into that caretaker role, caretaker opportunity, caretaker responsibility, and seeing that in a lot, no matter where we are, we have a part we can play. So I'm not going to read through this. I included it just because as I read through it, I was so moved by it, but I will send out a link later. It was the resolution for declaring racism as a public health crisis. It can also be found on the Board of Commissioners, on the Ingham County website, if you pull up the Board of Commissioners. And it's funny because I initially had put in the PowerPoint because I was going to pull different pieces out of it. But the more I read it, I was really moved by the thought and time that they put into preparing it, and really providing a historical perspective and also a charge for what needs to come. So, but this is kind of where the resolution plans to move forward on this issue. So, so what they've done with this resolution is declare that racism is a public health crisis and demands action from all levels of government. They've reiterated their commitment to improving the quality of health of our Black Ingham County residents, advocating for relevant policies that improve health in the community and support local, state, and federal initiatives that advance social justice, and assessing our current and proposed laws and our policies, as well as their implementation to promote health for Blacks within Ingham County. And so I just thought it was, I didn't want to kind of move too quickly, because I think that what they're calling them and our county to do is fairly important. You know, that it's important that we take time to really look at what the call is, look at what the commitment is, and then see how we can ensure as a community that we advance these really critical issues. And then part of that declaring racism as a public health crisis is they also passed a resolution for a racial equity task force. And that task force is actually in the process of being pulled together. And it's intended to be an advisory board. There are voting members as well as non-voting members. And the purpose is to really ensure that we have a clear guide, clear plan, and clear opportunity to really achieve equitable outcomes. And so what they've requested is that this task force set up recommendations that help ensure an alignment of resources and investments at this aim of creating equity. That there's some clearly identified metrics which then can be tracked and reviewed and as a guide, and that there's an ongoing convening of county residents through listening sessions and other opportunities to make sure that we're continuing to prioritize the needs of Black residents in Ingham County. And then the health and all policies, same thing is really the focus of making sure that there's a plan to apply an equity lens to all aspects of policies and decision making. And that's kind of that, you know, what can I do now? What can I do from where I'm at? There are a lot of ways in our everyday lives that we can practice and start implementing equity lens perspective. Next steps. I left this blank on purpose because I think that really the next steps, there's a lot of stuff that we can do individually, and we can do it in community. But the reality is that I believe the responsibility does lay with us as individuals. And it does lay with us in terms of how we decide we want to move the conversation and our action. There's not going to be a cookie cutter approach, and there's not going to be a one approach fits all. It's not going to be something that we do and we are able to say that in December 2021, we successfully eradicated inequities in our community. So it's really thinking about, I think, the ways that we plan to integrate this into our own personal way of being, and also find ways to stretch out into our other networks and see how can we start being part of this or continue to be part of this commitment to equity and stewardship. And then I will kind of end with that and with this quote by Audre Lorde: "There's no such thing as a single issue struggle because we do not live single issue lives." And this really resonates for me, that there are a lot of ways to advance issues related to racism and social justice issues, and be sure that we make our mark in the lives that we have, to feel like we are part of the struggle. And so thank you very much. I feel like I've talked way too much this evening, but feel free to let me know if you have any thoughts, or I'd love to hear any feedback or thoughts that you might have.
Adriana, I think that was wonderful and very helpful. Thank you. And amazing to me how really connected it is to the gospel. I mean, whenever you talk about caretaking for our brothers and sisters, that, you know, that's at the heart of what I think living out our faith is all about.
Mm-hmm.
Are there questions, anyone you'd like to ask of Adriana? Just unmute yourself and talk if that's the case.
I was just reading recently that here in the US in the COVID issue or pandemic, that we have a much higher death rate than, we're like number 18 of developed countries, very low in our ranking in terms of, because we've had so many people have died. And just, I'm just wondering, just our overall healthcare system, what your thoughts are about that, if that contributes to it. I know there's other issues, of course, and some of them are political, but I want to go into that. But just the healthcare that we have and the way it's established here in this country.
Yeah, I think it's very interesting. I wish that that video had played, so that's why I'll make sure that I send out the link. But what was interesting I found in that video is that at the end of it shows where we are in terms of life expectancy, and the US is number 43, you know? And so in terms of what you're saying, you know, I really see these issues of health disparity have been, you know, play out in so many different ways. And so COVID, a lot of public health professionals and other individuals in the work will say, we knew that this would happen in terms of health disparities because it's been happening. You know, I think that there's often discussion around infant mortality, you know, and the different rates for those who identify as Black and African American versus white infants. Like, so the mortality rate, even among children and infants of color, is unbelievable. You know, I think that the rate that was included in the resolution was that Black infants, the infant death rate is 2 times greater if you're Black or African American versus if you're white. And what they've seen, I need to find some of the research and get some more documentation, but what they see is that does not change even if you take into mom's educational attainment. So when it doesn't matter. So the idea being that it's not that these issues of racism are so intense, and play out also within our healthcare system, you know, so that the quality of care can be different based on color of your skin, you know, and what some of the literature out there too is talking about how do we address this from two angles? So how do we make sure that we're educating medical professionals and those in healthcare, while simultaneously also making sure that there's greater diversity within the medical field? You know, making sure that we find ways to continue to diversify our workforce and give opportunities and really think about these things from a lot of different angles. So I know that that wasn't exactly what you were referring to, but it just reminded me of that whole, how is our life expectancy so low? You know, and if our life expectancy, you know, is that far below what we would anticipate given what we believe of our nations and our nation's ability to provide quality care, then kind of where's the disconnect, you know, like, and have we become, like, are we okay with this level of disparity in our country? So that's kind of, I get off track sometimes. I think I just managed to get myself off track, but
maybe just one quick query and then I'll be quiet. But just thinking in terms of unconscious racial bias among police officers, do we have that same issue then with healthcare workers?
Yeah, I mean, what I would say about implicit bias is we all have it. You know, so I think that we could very easily say that across different, you know, across the professions, like we carry with us implicit bias. And so for a lot of time when I think about this, I think about, okay, so how do we address the implicit bias? Like, how do you ensure that we have systems in place where we can start ensuring that implicit bias, that the bias is not negatively impacting others? And so, yeah, I think that we carry pieces of the bias with us. And so it's really making sure that we have systems in place, strategies for reviewing our policies, reviewing our procedures, looking at data, digging into data, doing data with communities, saying, what do you see here? What are your concerns? Because yeah, I think that we probably would see implicit bias across professions, you know, and so it really ends up with what's our anecdote to that, given that implicit bias exists, what's our anecdote? I know that there's that, you can take in the Harvard's implicit bias test, and I was listening to a speaker the other day, and she's a professional in the medical field. And she said, I take it every 6 months. And I make sure that I have someone that I work with, you know, that I'm a colleague with, that I can talk about these issues. So it's also that idea that it's not, none of this stuff is one and done. Just like the work isn't one and done in the community, the work on ourselves to be critical and thoughtful isn't one and done. You'll see that I just recently started to use my pronouns in my name on Zoom. And that was part of education that I received from a close friend who's very active within the LGBTQ community, that said, by you putting that into your name in meetings, you open a space for others, you know? So this idea of her educating me and giving me an opportunity to see, you know, how I also have implicit bias, because in ways in the world, we kind of move through different spheres. And sometimes I'm part of what would be kind of considered the majority or the norm view or perspective, and sometimes I'm not. And so she reminded me that part of this is an opportunity to open the environment, to be inclusive, to put ourselves out there in ways that we might not be thinking. And for me, when it comes to those level issues, it's about broadening my equity lens and thinking, making sure that I think about how I'm perceived or how I present, or what ways can I make sure that in a room of people, like in a work meeting that I'm not familiar with everyone, that I can make sure that someone knows that they can see me as an ally when it comes to LGBTQ issues, or they need a thought partner, or they want someone to be able to know, is this person safe? Like, what are the different things that I can do in my own life to open that up to others? And so once again, I think I went down a different pathway, but kind of that implicit bias thing. How can we be thinking about it intentionally in our work outside in the community, and then intentionally within ourselves, like kind of catching ourselves in our own the own bias that we might find, and then finding someone, a colleague that we can trust, that we can use as our mirror. And so, but it gets complicated, you know, but I think the starting point is talking about it, learning about it, finding a comfort zone, pushing past that comfort zone, stretching a little bit. And I think that all that comes with practice. We're going to stumble, we're going to make mistakes, but if we practice putting ourselves out there, and we practice saying to somebody, well, you know, that kind of bothered me when you said that. I'm not really, could you tell me more about that? Or I wasn't really sure what you meant. Could you let me know? You know, and finding new ways to open dialogue and connection, and to be critical, and obviously, I think in a lot of ways, we need to diversify our networks, right? We often end up having very insular, homogenous networks to some extent. And so a lot of this work gets a lot tougher, but more rewarding as we open our networks and kind of really challenge ourselves, but in a really loving, engaging way. What are my opportunities for growth? Like, what might I be missing out on? And I have a colleague and a friend that often talks about like moving from the comfort zone to the stretch zone and knowing when you hit the panic zone, you know, like, so there are these, when you talk about these things, it brings up feelings for people, but we have to kind of find our sweet spot in the stretch zone, because that's where we're going to have personal growth opportunities. Now, know when you're in the panic zone so that you can kind of, you know, get support from other people. But there's a lot of stretching that we can do. And I think stretching with practice, it becomes easier. It really does. And we'll stumble, like I said, we'll stumble, but we'll practice and we'll push, and we have to push internally and then get used to pushing, calling for accountability and greater action globally.
Adriana, one of the things we're trying to do is to get to that place where we are stretching ourselves as a white congregation in a wealthy suburban area, to actually be in relationship and network with people of color, and particularly Blacks in our own county, and looking for ways that we can do that, and not in a way that feels like, oh, it's the middle class white folks who are coming in to fix things, but as a way to be an ally and engage with, and allow ourselves to be led by people of color. And wonder if you know of places, networks like that we can begin to explore relationships with.
What I'll do is I'll definitely think about that, and I'll kind of connect with some of my colleagues and friends and see what their thoughts are. Because I think that you're right. There's growing that network is essential to this work, and finding a way for it to be a partnership and a collegial relationship, I think, is also really important. And so what I would say is just give me a little bit of time to think about that. And then I'll definitely get back to you.
I just want to say I loved your topic, and when you talked about it's not the race of the person that affects their health outcomes, it's the racism. Like, that's really going to stick with me, and I can't wait for next week that we can process this. But already I'm thinking of our community school partnership with a Lansing school, and I'm also thinking about our food pantry. And I mean, Rick and I sometimes just get to be just, you know, a part of conversations and get to hear and see how things have grown and changed, you know, just since my time coming to OCC. And I don't have a big part in the food pantry. I really don't. But just instead of equality, being more equitable, and just seeing how that has like changed, you know, and just not everybody wants or needs the same thing when it comes to their food. We have different cultures. We have a family size. We have so many different things. And so it would never make sense to just give everybody all the exact same food. That would be silly. So, I mean, really starting to look at it, and it was like, I don't know that we had the vocabulary that you were talking about, but it kind of, that's what it started. Rick, did you catch that too? It's sort of like, hey, we were kind of advised, you know, not we, but, you know, the food pantry, you know, like, yeah, I mean, giving everybody the same exact bag of food doesn't actually meet everyone's needs. So I'm excited to talk about that next week.
Well, one of the things I remember is when the Greater Lansing Food Bank, you know, we said, well, we do it by size. And she said, well, a family with 2 children that are under 5 has different needs than a family that has 2 children that are 15 and 16-year-old boys. Right. So, you know, that was equity. It was saying that family might need more food with teenage boys or girls than the family with little children. And it was like, oh yeah. But we were doing equality. No, everyone gets the same.
Go ahead, Sue.
I have something to add here in the last thing you said regarding equality in the food bank. I take a family around frequently, or a member of a family, to the food bank over the years. And I noticed that East Lansing can't come up with the food that she needs. They have the food for college students who are in trouble. And instant dinners are, well, she doesn't read that well, or her cooking never involves reading. And therefore, reading directions on a box is not going to get the meal, even if it is different. And she wants, like, I just went to Aldi's with her, and she bought, let's see, 10-pound bags of flour, and there was 2 containers of that. And I think she's got flour for the winter, perhaps. And that is a difficult thing for her to carry. When we tried to carry 10 pounds, 10 bags of 10 pounds each, that was a real problem trying to get it into her house and into the car. Although she could ask somebody at the store to help her get it into the car. And, you know, she just wants oil and flour. That's her basic food.
Right.
And she's not going to change. Rice might be added to it. And we have this that we've been talking about frequently, is just talking about the Black people. Well, we have so many foreigners and immigrants and refugees in this town that it doesn't always mean the Black people, you know, it doesn't fit these other groups, the Somalis and the Afghanis who are have less education, have less of everything. And we have to remember that as life changes in our country, we're going to have more of that kind of people who are running from wars and running from hunger and disaster throughout the world. And there are going to be all kinds of people. And our African-American people, actually, a lot of them have good jobs. And certainly a lot of them don't, too. But, you know, it's just it's a changing phenomena of who we're dealing with.
Yeah, and I think what I appreciate about that too is that that's why I love even the concept of an equity lens, because it really allows you to think about who you're looking to be in relationship with and who you're looking to, if we want to include those that are here that need to be at the table, that equity lens, although it might look different for different groups, so newcomers to the country might have different needs than other communities, or it allows you to really focus on how do I use an equity lens in all of my practice to make sure that I'm engaging as a steward, as a caretaker, as a follower of Christ, you know, in terms of my interactions, you know. And that's what I love about it, is that it really allows you to be, if the goal is inclusion and engagement and partnership and friendship, then it's a fairly simple concept. It's really about how do we make sure that we're living it. I think the Reverend said the same thing at the last week's 2 weeks ago, when she said something like, it's a simple concept, you know, and it's really about making sure that we hold ourselves accountable and open to make sure we're following it and we're living it. And that when we see areas that need to be corrected, we find opportunities to correct it. Because like you said, everyone's dealing with different situations, you know, and so if instead it's an opportunity to lean into those relationships, it can be a very simple practice, you know. Your, like what you were saying, your engagement with that individual and knowing what she needed might be different than somebody else, and helping her, listening to her and identifying it and helping her address that was just the same, like the same practice, you know. And so I think it's, I'm always overwhelmed and optimistic when I think about, hey, like we can do this, you know, like this is something that we already live in many ways, and just need to make sure that we're continuing to advance and integrating to address some of these very real disparities that we see.
Well, thank you, Adriana. This has been really informative and helpful. And I think Ingham County was the first county in the country to pass the resolution about racism as a health issue. I mean, it now has caught on, and communities and municipalities are doing it, but this is a place that was on the cutting edge of that. So that's a good thing. And thank you for your work there to help us as a county begin to see racism from that health lens and how it affects. And I like what you said about it's really not about the biology. And we often want to say, oh, it's just you know, it's in their racial biology that makes them more susceptible. It's like, no, our biologies are pretty much the same, even though our amount, whatever that pigment is that affects our skin color varies. That's a minor difference. So next week we will meet and process this and say, you know, what did we learn and what are the impacts and how might we do things at OCC that move us down that path. So this will be posted, and if you need to review it again, like I know I took screenshots of several of the slides, so I would have them know you can do that and encourage friends to do that as well. Are there any final comments or questions? Well, let's give Adriana applause and thank you so much.
Thank you.
No problem. Thank you for having me.
Thank you. So next week, same link. It'll get us here to, so still the speaker series link will get us back here. All right. Thanks, everyone.
Thank you.
Bye. Good night.
Bye.